So as a background, patients who come in with an acute stroke, who come in within a certain window, and the window used to be 3 hours and then got to be 4.5 hours, but now we also look at wake-up strokes also, so the window is increasing. We, in the appropriate patients, we give them drugs that can open up their arteries, so we call it reperfusion, so blocked artery that opens up. And for reperfusion, most of the work over the years has been done with a drug called tissue plasminogen activator, or Alteplase. That drug is very good. It works well, but it's a bit of a pain for everyone because you have to give a little dose as a bolus, and then over 1 hour you give the drug. And so it's always been this push to look for better drugs. So TNK is a newer agent that is that's more potent in a sense. It's more specific to the clot, and it's given as a bolus. And there is some evidence, not a lot of evidence, that it may be able to open up bigger clots also, not just smaller ones. So with that data, there's been of course, been an interest in centers to switch from Alteplase to TNK or Tenecteplase. Now, the problem and the reason for the debate is that anytime one agent is considered to be better than the other, there's a whole bunch of criteria that you've got to meet. So first of all, you need to have very good studies because you're going to make a change that's worldwide, and it's not good to go back and forth, right? So those studies are underway. Some of them are complete. Some of them will be presented in France at the European Stroke meeting in May or June. But until those studies are presented, well, the next step, of course, is that once those studies are presented, then there are guidelines. So there's European guidelines, there are North American guidelines, so Canadian guidelines, and American Heart Association guidelines. So the data has to be interpreted outside of the investigators themselves, but by key opinion leaders who would then make a recommendation in the guidelines. Well, it's time that you may consider the switch or can use both one or the other as per your comfort level. So that hasn't happened. So a long answer to your question is, why debate it? Because A, there's a lot of evidence that Tenecteplase may be better than Alteplase, but we're not there yet to make that recommendation. So my colleagues, one of my colleagues from Norway is going to say, we have enough data to make a switch. I would say, not yet. Hold on. Let's wait until we get some of these studies in the public domain, and let's wait for the guidelines to make the recommendations.